Thank you, and thank you to all of our speakers. I'm going to ask Erin to come back on and let our participants tell our participants how they can ask questions at this time.
Certainly, if you'd like to ask a question, please press star, then the number 1 on your telephone keypad. We'll pause for just a moment to compile the roster.
Sure. So one of the questions that came in online earlier was about basic health plans, and I think it was during Jenny's presentation, and how you think a basic health plan sort of will fit into or change the coverage landscape going forward. You might be on mute, Jenny. I have to remind our speakers.
I know I am on mute. I'm off mute, but I was also wondering if Cindy might be following this closer than I am. I know that there are a couple of states that are launching basic health plans, which would which really are targeted for the less than 200% of the federal poverty level, and would offer an opportunity for parents and kids to be in the same type of coverage. But beyond that, I'm sure others maybe have more insightful things to say than I do.
Yeah, well, I can jump in. There are 2 states, Minnesota and New York, that are proceeding. There's no deadline, though. A state can think about jumping into the basic health program at any time. And, well, different cycles in open enrollment, I should say, but any year. And a lot of the reasons why some of the states are thinking about it, and certainly was true for Minnesota in particular, was to reduce churning. Obviously, you still have people moving between 200% and 201% of poverty into the marketplace. But to the extent that the basic health program is designed largely to be to build off the Medicaid and CHIP programs, that there was more continuity of coverage and of care for people who would otherwise have been flipping between Medicaid, CHIP, and the marketplace at that income range. So they're just getting, just getting started, and I think we'll have a better sense of how it works in those 2 states over the next period of time, and whether we have some other states jumping in.
Great, thank you. Erin, do we have any questions on the phone?
No questions on the phone at this time.
Okay. Another web question that came in was whether the speakers could offer any insight regarding the impact of transportation barriers in terms of access for children enrolled in Medicaid and CHIP. Made any kind of progress in that area, or any examples to share?
Hi, it's Steve Friedhoff. I can chime in a little bit on that one. I think that, one of the programs I highlighted in our South Florida program around complex children, and again also in one of our foster care programs, transportation, is a part of the services we offer to try to improve access. I think I'd also mention that even for the first postpartum visits, one of the things that we try to do is have outreach specialists not only make the appointment but arrange transportation, when possible. But so we actually do find that transportation is a very significant issue, and it varies according to the market. So, in some of our members who, for example, live in New York City, the logistics of transportation are the infrastructure is there, and the geography is close, but yet still there's a coordination aspect that needs to take place that can be problematic for some families, particularly for during regular office hours and after hours. You take that to places like Nevada or some of the rural counties in Northern California, and you could be talking some fairly substantial distances. And, not surprisingly, you also find that, sometimes the places where you need to access care are also not on, more typical public transportation routes. And I think one of the examples we've found with that over time has even been with, trying to expand access to urgent care centers as an ER alternative. And, I think that the reality there is you find that some of the most common, clinics or urgent care centers are typically the companies that start them tend to base it on, demographics and certain types of access. And they're not always accessible on public transportation lines, whereas, hospitals, emergency departments frequently are. So the short answer to your question is yes, it's absolutely an issue, and within the confines of what we can do in a given state, we do find that transportation is a very significant service that we can offer, particularly for our highest needs members, or at times that are most critical during the healthcare journey, like the first postpartum visit.
So this is Jenny. Just wanting to jump in that I'd be glad to send you, Catherine, some national statistics on the extent to which people report that that's a barrier in terms of access. I think one of the other questions that came in even in advance of the webinar was financial versus non-financial barriers. And so I think we do have some data from the perspective of parents to the extent that this leads them to delay care or not be able to get care on behalf of their kids or themselves.
Great, thank you. Another question that just came in for Joe. Could you speak to some of the examples of the incentives for healthy behaviors and preventive services in Indiana that you mentioned?
Yeah, absolutely. So the Health Indiana plan is set up so that we have a power account, which is equivalent to a health savings account, and it's connected to a high deductible health plan, which is managed by one of our 3 managed care contractors that I mentioned. And the program is set up so that if you have dollars left over in your account at the end of the year, and you get your preventive services, so you have to get just one of a list of, I believe, 288 possible preventive services. If you get just one of those preventive services, then you're able to roll over more dollars into your account the next year. And in fact, it doubles the amount that you can roll over into the next year, which offsets your contribution to the program in that following year. So you actually get rewarded financially through lower contributions by getting a recommended preventive services. In addition to that, the managed care plans also provide incentives, and all of them have different rewards programs that they give to members that get a recommended number of services or visits for prenatal care.
Thank you. Aaron, do we have any questions on the phone?
There's still no questions on the phone at this time.
No questions. Everyone's listening on the web today. Well, I'm going to ask a closing question if any of our speakers would like to offer to the audience sort of their perspective on what they think is, one of the most pressing concerns or policy issues going forward related to access to care or coverage for kids that we should be watching and paying attention to. Maybe we'll start with Jenny and go from there.
I think in the short run, the issues that we're going to really want to focus on are for kids who have health insurance coverage. How well is that coverage working to get them the care that they need in a timely fashion? And so I think the focus on Medicaid CHIP, employer-sponsored coverage, and marketplace coverage, there are just a whole host of questions we need to be drilling down and looking at there. I think a little bit over the horizon, we're going to need to keep our eye on the ball in terms of whether we're reversing course in terms of the progress that's been made as to whether kids have coverage at all.
Thanks, Jenny. Cindy?
If the question is broadly where should we look at access, I think that making sure that transitions are working well for kids. There's just a lot of fluctuation that goes on in people's lives that will affect which program or whether it's employer-based coverage that they may be able to get their health coverage from, and making sure that those transitions in terms of eligibility don't produce gaps and affect access, and then to the extent that they are prompting significant changes in terms of networks and access to providers, I think will be some big issues for kids as we continue to go forward. That's sometimes hard to track, but I think really important for everybody to keep an eye on. And I think the other issue about CHIP potentially disappearing that Jenny brought up, the potential of kids being uninsured, but there's also, in addition, issues of the robustness of the benefits in the commercial market for kids, and particularly marketplace plans have not necessarily been focused on children. So I think a close look at the scope of benefits for children in CHIP, Medicaid, marketplace, and ESI would be useful as we continue to think about the future of CHIP.
Thank you. Steve?
Well, I certainly agree with everything that's been said, and I think I'll take a slightly different tack along the lines of continuity and transition, but this time focusing on postpartum moms and women of childbearing age. I think that so many of the issues that affect children start with having or not having a healthy pregnancy. So women need to know that they're eligible potentially after delivery, and the newborns are eligible after delivery, and need to be educated in that regard, and need to have that kind of access. I think it's critically important, in particular for women who've had a high-risk pregnancy, that they extend into Medicaid coverage beyond the postpartum period. And frequently it's to cover chronic conditions that they have that might have contributed to the high-risk delivery, and hopefully prevent a subsequent occurrence. And sort of along those same lines, I think there's a pretty substantial care gap in the need for screening for substance use disorders in pregnant women, and also during the interconception period. I think there's very few OBs and treatment centers who are comfortable identifying women with substance use disorders and treating them during pregnancy. And I think both for medical, behavioral, and substance use disorder issues, I think being able to address that in the preconception, interconception, and early pregnancy is just critical.
Thanks. And Joe, you get the last word.
Thanks. I actually agree with a lot of what Cindy said about the coverage programs and how they fit together. I think clarifying some of the overlapping coverage programs in the Affordable Care Act, really encouraging more private sector coverage of kids, and fixing the family glitch, I think is probably the single biggest thing that could contribute to advancements in coverage of kids moving forward.
Great. Well, thank you all for joining us today. We really appreciate it. And to our audience, we hope that you'll provide us some feedback on this event. We'll have an archive recording of the event available, and we'll make that available to everyone that registered. So thank you all again.